At 32, I'd basically gone from having a girlfriend, a home, a fully furnished house, dogs, a life, a job, to 32 years old living in a single room in my parents' bedroom, in my parents' house, and my entire world was a single bed and a couple bottles of alcohol and a bag of drugs. I became a drug addict because I was naive enough to think that it wouldn't happen to me. I used and I loved it, and then I used to the point where no matter what I tried, I could not stop.
I picked up my drug of choice during COVID, and during that time my mom had just been diagnosed with cancer. And then like 6 months later my mom passes away. This fear of just wanting to run away from all of my problems like I had done throughout my entire life, I couldn't, and now I had the substance involved. That made everything worse, you know. So eventually I called my friend and I just said, I'm broken. Like, I can't do this anymore. My whole life I've just been constantly running away from myself, you know, because it's like, it wasn't, like, my problem didn't start with the drugs. It started like way back when. So eventually I was like, you know what, okay. And I put myself into changes for a year. And it was the best decision that I've ever made for myself.
The 21 days in the primary care was amazing. I learned a lot about myself. I explored a lot of my behaviors. I came to terms with the fact that I was an addict and what that meant. They encouraged me to do long-term treatment, and I think that truly was the turning points in my life.
I want to say that I had a really good time, but I don't mean a really good time as in like it was fun and fantastic. I had a really good time as in like I changed my life and I put my best foot forward.
I've got my moral compass back without anything forcing me to go in another direction. It's not just fleeting. I've managed to experience true happiness, not stimulated happiness.
And it's just, for me, it's just about accepting myself for who I am, flaws and all. And I'm truly, truly grateful for changes and for what the program, the clinical team, and for what the program has just given me. Thank you.